is Solberg. I am president of the River Valley Media Group and proud publisher of the La Crosse Tribune. On behalf of our company and all its dedicated employees, I would like to welcome you to our annual Nurses Week celebration and program. For the second year, in what has quickly become a proud tradition, the La Crosse Tribune is pleased to be able to share these remarkable stories of nurses in our community. These are stories of dedication, empathy, compassion, and caring. Stories of helping others through difficult times of physical and emotional challenge. Stories of healing, recovery, and sometimes comfort and condolence. They are stories of nurses in our community. As well, this year's program takes on only added relevance in light of the critically important work these nurses deliver helping our community through this difficult pandemic. Enduring incredible personal risk to themselves and their families, their dedication to helping others rises above all. As you can imagine, selecting our Nurse of the Year from among the myriad extraordinary contributions from our area nurses is quite difficult. The nominations were all inspiring. But we have. Here we celebrate and honor all of our community's nurses, and one in particular. I would like to personally recognize and thank our generous sponsors, including Mayo Clinic Health System, Gunderson Health System, Winona Health, and Minnesota State College Southeast, without whose generous support none of this would be possible. As well, special thanks to our esteemed selection committee, including Tim Contour from State Bank Financial and Joanne Sandvik from the University of Wisconsin-La Crosse. We hope you will enjoy our celebration of nurses as much as we enjoy bringing it to you. From all of us at the La Crosse Tribune, thank you.
Hi, I'm Jason Frasty, the Chief Nursing Officer at Mayo Clinic Health System in La Crosse. I want to take a moment and just say thank you to all the incredible nurses across our region. It has been a trying time through all the COVID and other related things that we've had to endure. For that reason, we've had to delay the celebration of our nurses. But the Tribune has done a wonderful job of bringing that back together as we sponsor this event in your honor. We are very, very humble and very pleased for all of you and your participation in this event. I'm very thankful for all that you do and for all that you'll continue to do throughout the year, but I hope this recognition is one way to show our thanks.
Let's meet our outstanding nurses for the Heart of Healthcare 2020. Jamie Moody, Gunderson Health System, La Crosse. Jamie followed her mother into nursing and has served as a critical care nurse at Gunderson for 29 years. She's a charge nurse, a preceptor, a trainer and mentor of other nurses in critical care, and she's very proud of her co-workers. She was instrumental in developing a 20-bed negative pressure unit to treat COVID-19 patients from scratch.
So I first started thinking about being a nurse because my mom is a nurse. And then I looked into Viterbo College, which had a great reputation, and that brought me to La Crosse and to my nursing career. Some of the stories that she would tell and the difference that she made me want to have that impact on people as well. Basically, what keeps me in nursing is making a difference in people's lives, if it's the patient or their family or my coworkers. And what keeps me in critical care is definitely my coworkers. We get each other through some difficult situations and generally have positive outcomes. I had an unexpected experience in the COVID-19 pandemic. My boss, Renee, took maternity leave, and I was honored to be asked to cover her for maternity leave for 12 weeks. Should have been pretty routine. I had some training. I was all set. Well, it wasn't routine. 4 days after she had her baby, we decided to make a special precautions negative pressure unit. And guess who was in charge of that? Myself from the ICU side and then a coworker from the medical side. So that started 12 weeks of unpredicted experiences. It's very humbling. I think many nurses day in and day out do an excellent job, and I'm very honored to have been chosen and acknowledged for the hard work I've put into my career.
Kayla Holton, Mayo Clinic Health System, La Crosse. Kayla specializes in special deliveries at the family birthplace at Mayo. She considers it a privilege to be with the family on birthday. Kayla is known for delivering calming support and apple juice to mothers, fathers too.
Hi, my name is Kayla Holton and I work in the family birthplace at Mayo. I decided to become a nurse when my mom got cancer for the first time when I was 8 years old. I was really into the human body and all the different procedures and stuff she went through. And then I never really changed my mindsets. Labor and delivery is amazing because I get to be a part of people's birth stories and being with patients in their most vulnerable times. Some people think that labor and delivery nursing is just cuddling babies, and there's so much more to that. I am sometimes there for people's worst days of their lives, unfortunately, when they lose their babies or they're really sick or they have different things going on. But overall, I love my job.
Lydia Paulsen, Sauer Healthcare Center in Winona. Lydia started her dream career as a nursing assistant at 16 years old. As RN manager, she works hard to have a positive impact on her patients. Coworkers say Lydia is known for her professionalism, delegation, communication, compassion, and hands-on nursing skills. She provides endless emotional support to the residents and families she cares for, putting them before herself. Lydia is working on her master's degree and studying to become a family nurse practitioner.
Yes, I became a nurse because I had a passion for caring for people. I became a nursing assistant when I was 16 years old and sort of fell in love with nursing there and knew that that was where I was going to land in my career. Yeah, so I do case management right now. I'm an RN manager for a 41-bed unit in a skilled nursing facility. So that consists of long-term care as well as rehabilitation, after surgery, things like that. So more short-term stays. I really enjoy the bedside part of that. So that's been the majority of my career, is being at the bedside. We have these moments with our patients or our families, and the days get long and the hours can be long and the situations can be stressful, and then there are these moments that you get these aha moments. This is why I do this, something really rewarding, whether it's a thank you or just a moment that you get to share with somebody and kind of rekindles the fire to take care of people. The biggest thing is that these people come to you during their most vulnerable times, and it's very rewarding to be able to identify something that is personal for them. If you can bring them their favorite meal or do something to make them more comfortable, and I guess to watch the positive impact that has on them and their recovery or their quality of life. That's really my favorite part of doing what I do. I am completely flattered and honored. I was really surprised to know, and I think it's kind of cool. I don't have a corporate backing like Gundersen or Mayo. I'm at this small standalone facility, and I sometimes think that the skilled nursing facilities are sort of the underdogs. People sort of think that it's this easy job and you're taking care of old people. And so I think it's really, really cool that I get a chance to talk about, what I do, and I really feel passionate about it. It's important, and I'm very honored to have the opportunity.
Sharon Brownsville. Sharon has been a nurse for 61 years and has served her community and her country with pride. She was La Crosse's first certified oncology nurse. After working in intensive care, Sharon joined the Army and served during Desert Storm, at times treating patients while flying in helicopters. She received an Army Achievement Medal for her service. She's still active in nursing and helping Houston County Public Health with contact tracing during COVID-19.
I just wanted to be prepared to do something for people. And there's no better way to help people than to be able to help them when they're in their time of needs. I had a fabulous career. It's been the highlight of my life to be a nurse. I early on did general medical nursing and learned the basics. And then I went into 5 years of psychiatric nursing. And I worked with the developmentally disabled for quite a few years. I worked for the state of Wisconsin for 20 years, and that's where the mental health, the disability. And then I went to University Hospitals in Madison and was a recovery room nurse, and then a coordinator for a cancer pain team in the oncology unit. And that was a very satisfying job because you could deal with what was really bothering people who were trying to recover. And so I did that for a number of years until I moved to back to Minnesota, and worked as the acting public health director for Houston County. And from there I went to Houston County Group Homes as a health service coordinator and set up the new group home for people returning from state institutions to the county, and did the health component of that. And then I went back to Mayo, St. Francis, and worked as an oncology nurse for many years, and was the first certified oncology nurse in La Crosse. And then I went into the Army in Desert Storm, and that was a very rewarding thing to be able to do, to serve with my country during Desert Storm. I got to set up intensive care units in Germany in an old prison camp of Hitler's that they converted to Landstuhl receiving hospital. And I came back and worked at, I've done a lot of assessments for long-term care people. I did workers' comp assessments and then now long-term care. And that's what I'm still doing to this day. So I got to do what I set out to do by becoming a nurse. It's been very rewarding. And I kind of hate to even take any spotlight at this time, because the nurses that I see now in this pandemic stepping forward are the real heroes of the day. If you can reach out and help people when they need it, you can have a very satisfying life. That's probably the most satisfying thing you can do in life, is help people who need it.
Robin Hogue, Winona Health. Robin began as a nurse 32 years ago, caring for patients who had undergone acute surgeries. Today, she's Chief Operating Officer for the hospital, and one of her daughters is a nurse at Winona Health too. Robin was inspired by a neighbor who was a nurse and a Winona State University professor. Robin says, "To me, it's an absolute privilege to be able to support the other nurses who are doing the direct patient care. Having done a large chunk of my career in bedside nursing, whether that be bedside in a hospital or in the community, I rely on those experiences a lot."
I saw Nurse of the Year, and it didn't even take more than 3 seconds, and Robin dawned on me, and I thought she'd be a really good fit. Robbie's nursing skills aren't always shown on the floor, but she's worked her way to an administration level, and she's an awesome administrator. She's very involved with her employees, and she's a great overseer, and she does use her nursing skills. If she sees a patient who needs something, Robbie would never hesitate to step in and help out.
Robbie is like an excellent choice as, the Nurse of the Year. She's been a nurse for decades, and has worked across the continuum in a variety of different capacities, and I think has demonstrated throughout her career her commitment to nursing, advancing nursing, but always really patient-centered. So, I've known her for 18 years, and so in all of the time in my experience with her, I think she is she's the poster girl, poster woman for, Nurse of the Year.
I started my entire nursing career here at Winona Health. I started in 1988. I was on the very floor that my office is located on the surgical floor, meaning taking care of post-acute surgical patients. From there, transitioned to home care, where I did the majority of my bedside patient care, and was the highlight of my career being in home care. And from there had an opportunity to get into the administrative side of nursing, and so since 2003 that has been my role. To continue in the administrative side of nursing, to me it's an absolute privilege to be able to support the other nurses who are doing the direct patient care. Having done a large chunk of my career in bedside nursing, whether that be bedside in a hospital or in the community, I rely on those experiences a lot and remember those a lot to be able to support the staff when they come through my door with certain issues that they have. That's what keeps me going, when I can help them do better at their work. My memories here, my first day, I work with some of the same staff at Winona Health. We're very fortunate in that we have a lot of longevity in our staff. Working with some of the very nurses who oriented me on my first day, still to this day, is another thing that keeps me going. Hardest parts of my career, transitions. I really enjoyed my home care career. It was one I'd go back to in a heartbeat, just because I miss that patient interaction day to day, the challenges that are out there. Needless to say, as you sit with your mask on, COVID's been a challenge. But there are day-to-day challenges with staff heartbreaks, watching staff care for people who aren't doing well, and just having to surge through those each and every day. To this day, just yesterday, I heard a patient coming off the elevator, was admitted from the ER. They came around the corner to get into the room, and just yesterday a patient said, "Oh, thank goodness Sam's working today." Knowing the community knows our staff, and to make those personal connections and to hear that is pretty awesome. Oh, I was overwhelmed. I was shocked. It was quite humbling to be nominated, especially in an administrative role. It was wonderful to realize that people still remember that I'm a nurse, because that is the passion for what I do, is that underlying nursing education and degree that I have. I have deep respect for those who have nominated me, and I appreciate it so very much.
Jenny Solberg, Gunderson Tri-County Hospital, Whitehall. Jenny's nursing career came as part of her quest to learn more about what caused her daughter's seizures. She has found enjoyment working in the dialysis department, and she has served as an instructor at Western Technical College. The patient who nominated Jenny says she was the first to get up when someone pushed the buzzer for help and the last person to go home. She truly is an angel with healing hands that touch the person's soul to change the most desperate cases into amazing miracles.
Actually, my daughter kind of led me into that field because when she was younger, she had seizures, so I kind of wanted to learn more about it. And my mom and my aunt were in the healthcare field too, so they kind of led me on that path as well. I really love working with my patients, and they all just bring meaning to my life every single day. There's always something new. There's always something that that I can do for them that I didn't even realize made their day better. You know, they have to go through a lot of different things during the day, and being there to listen to them sometimes just makes their day a lot easier. It's been really hard. You know, people feel like they're secluded, and they feel like you know, even for like the nurses and everything, we have to wear masks and everything. So it's kind of like we're not able to interact like we used to be, you know. So it makes it a lot harder to communicate sometimes. They can't see our expressions, and so it's kind of like it's really difficult to show that we care, even though we're behind a mask, you know. But it hasn't been extremely bad because we try to make it as easy for them as we can. We try to still talk to them like we used to, and I don't know, we just try to do everything we can to make them feel comfortable, and interacting with us really helps a lot too. So I really wasn't expecting it, so you know, I do my job every day the way I normally would. I try to make everybody feel comfortable, and I try to do the best I can to, you know, give them the best care they can, because I know they're in a hard situation no matter where they are, even if it's just coming in for well, when I worked in Whitehall, it was really like they were coming in from the community, so I really enjoyed, you know, getting to know them and taking good care of them and giving them that compassion that they deserve. And we really worked one-to-one with them. And so I work in dialysis as well, and so we do the same thing. We work one-to-one with the patients, and I think it was just an honor just to be observed like that, you know, like that somebody really appreciated it.
Tony Roxvold, Gunderson Health System, La Crosse. At age 42, Tony decided it was time to show his children what it means to follow your dreams. So he went back to school to become a nurse. It was a risk, but Tony says, "I was devoted to not failing." Today, he's a successful nurse in emergency care at Gunderson, known for his calm demeanor with patients and families.
My parents were both in the field of help. My dad was a state trooper and my mom was a nurse, so it had always been in the back of my mind. And got to be about 42 and finally decided it was time to do it. So I went back to school when I was 42, and I've enjoyed it. Love it. Patience, knowing I'm helping somebody, knowing I'm helping the community. And I live in a different town, so I try to help that community as well. And just helping others and making my kids proud. That keeps me motivated. The experience here at the hospital is that we've been well-staffed and well provided for PPE. That's the main thing I've gotten from it so far. I can tell Gunderson is not just talking about it. They're showing that they are able to provide what we need for safety. Everybody I work with could have been honored for it if with the patients they see every day. Some people are super appreciative, but just don't take the time to say it, like this family did. So it's an honor, but I know it could have gone to anybody I work with. So just honored.
And now it's an honor to introduce our 2020 Heart of Healthcare Nurse of the Year, Rochelle Underland, Gunderson Health System, La Crosse. Rochelle's career began with a textbook in a cupboard. Her father was an EMT, and Rochelle loved to pull out the text and read about anatomy and physiology. She started in high school as a certified nursing assistant at a nursing home. Today, she's a preceptor coaching other nurses who learn from Rochelle's experience. She specializes in neuroscience and has earned CNRN and SCRN certifications. She's incredibly proud of the people she works with, and they're incredibly proud of her. Her coworkers say Rochelle is always out for the patient and family's best interest. She is a strong patient advocate and strives to create a healing environment for patients and their families by taking time to educate, answer questions, and promote understanding. Rochelle is respected by her peers across all spectrums of care.
I've always had an interest in healthcare sciences. My dad had an EMT textbook in the cupboard when I was young, and so that was kind of interesting to me. I'd go up in the cupboard and take it down and start flipping through that textbook. And when I was in high school, I became a CNA in a nursing home, and after that, I knew I wanted to be something in healthcare, but that kind of solidified nursing as a career for me. I enjoy the human interaction. I like, coming to work, using my critical thinking skills, putting the education to work that you invest in. We have a good camaraderie amongst our colleagues. You're surrounded by people who are intelligent and compassionate and kind, and we all have the same goal of wanting to help people. And, you come to work and you just enjoy the people that you're with, enjoy the patients, enjoy their stories. We've had a really great response from our colleagues, stepping up and staffing the COVID unit voluntarily. Just their selflessness that's come through is amazing. We have patients, that have had restricted visitors, and that's a huge thing for them, when they can't have their loved ones at the bedside, and it's a sacrifice. It's something that, everyone is kind of doing their part so that, in the interest of public safety, we slow the spread of this, but people have been really good. People have been understanding, and, we're making our way through it together. It's very humbling. It's something that, I was very surprised to see, and it is an honor just knowing the caliber of people that you work with, and there's so many people that are deserving of this kind of recognition. There's just a multitude of people that are, just wonderful caregivers and so deserving of something like this. So it really is an honor to be noticed in this regard.
Congratulations to all the nurses who were nominated and honored as part of Heart of Healthcare 2020. We're sorry we couldn't honor you in person this year, but we'll be reaching out soon to present each of you with a plaque. A special thanks to our sponsors, Mayo Clinic Health System, Winona Health, and Minnesota State College Southeast. And thanks to our judges, Tim Kottner of State Bank Financial, Joanne Sandvik of the La Crosse Medical Health Science Consortium, and Sean Burke of River Valley Media. Thanks to all the nurses and healthcare providers who do so much to keep us safe and healthy, especially during this challenging pandemic. For all of us at River Valley Media, I'm Rusty Cunningham.